Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Our focus is the novel coronavirus. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former secretary of Maryland's Health Department. Our goal with this podcast is to bring evidence and experts to help you understand today's news about the novel coronavirus and what it means for tomorrow. If you have questions, you can email them to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, guest host Dr. Sarah Bennett talks with Dr. Chizoba Wonodi, the Nigeria County Director for the International Vaccine Access Center at the Johns Hopkins Bloomberg School of Public Health, and Dr. Anita Sheth, a pediatric infectious disease specialist and senior scientist in the Department of International Health. They discuss the impact of COVID-19 on immunization systems across the world. Let's listen.
Dr. Sheth and Dr. Wonodi, thank you so much for joining me on this podcast today.
I'm delighted to be here. Thank you for inviting us, Dr. Bennett.
Thanks for having us, Dr. Bennett.
Some of the other podcasts in this series have looked at how COVID-19 is crowding out other types of health services. And today we wanted to focus on how it was affecting immunization programs across the world. Dr. Sheth, what do we know to date about how the new coronavirus is affecting immunization programs?
This is a very important topic, and we're so glad you brought it up. This pandemic has resulted in disruptions in so many aspects of our lives. And around the world, we're seeing that essential health services have been paused and immunization programs have been disrupted, and children are no longer getting their required shots. Recently, the World Health Organization, along with our group at Johns Hopkins, did an analysis, and we found that 80 million children under 1 year of age in about 68 countries around the world are at risk for missing out on vaccinations. And these are countries where these services have been disrupted, and in some places by over 50%. So if you think about it, the global impact of this can be immense.
It sounds as if it could be really very, very significant. Dr. Wonodi, you're based in Nigeria. I wonder if you could give us a bird's eye view of how this challenge of maintaining immunization services in the light of COVID-19 is playing out in that particular context.
Yeah, what we're seeing here in Nigeria is that immunization programs are disrupted for a number of reasons. First of all, on the supply side, you find that health workers are afraid. They're afraid to be exposed to the virus when they go provide services without PPEs. And so many of them are not doing outreaches as they should. In Nigeria, about 30% of the population will rely on outreaches to get vaccinated. So that's a problem. On the supply side, again, we have issues where vaccines are not getting where they need to get to because of restrictions in interstate travel. And then when it comes to parents, many parents are also afraid to go to the clinics because they think the clinics are not open. And then also they're afraid to expose themselves or their children to the virus, to COVID-19. So it's having an overall dampening effect on immunization programs.
So we're seeing it play out both in terms of healthcare providers and the supply side, but also in terms of households and their seeking or demanding immunization services.
Absolutely.
Do you think that these challenges that you're describing are unique to low-resource settings such as Nigeria, or are we also seeing this play out in high-income countries such as the US and Dr. Sheth?
I think the reasons that Dr. Wonodi mentioned are global, and they are really happening all over the world, including the United States and Europe and in high-income settings. We know that the coronavirus crosses borders easily, does not respect economic strata, and the disruptions follow the same pattern. So in the United States, with the stay-at-home orders that we heard in March, we've seen, not unexpectedly, a substantial drop in outpatient pediatric visits. And then by May, we actually have data from the Centers for Disease Control, the CDC, that showed that there has been an over 50% drop in vaccines given to children during the first quarter of 2020 compared to 2019. And in the European region, we were already seeing a drop in measles vaccine being given to children last year. So this risk brought about by this immunity gap can be even higher and can have dangerous consequences.
That sounds like really quite significant consequences or effects of COVID-19 across high-income countries as well as poorer, low-resource settings. Dr. Wanodi, what do you think are likely to be the implications of these disruptions in immunization programs for vaccine-preventable diseases in the future?
Yeah, the experience from the Ebola epidemic in Africa in 2014 shows us very clearly that if we don't pay attention to addressing these disruptions, that we may actually have more deaths from vaccine-preventable diseases like measles. So, for example, in the DRC, there are studies that show that twice as many children died from an outbreak of measles in the DRC during the Ebola outbreak than died from Ebola. So in Nigeria, for example, we know that there are outbreaks of measles in Kebbi State, in Adamawa State, and it may not be unconnected to the disruption in immunization services. So we'll have more deaths from vaccine-preventable diseases like measles if we don't address the issues head-on and try to restore services, restore people's confidence in seeking immunization care services.
Thank you very much, Dr. Wanodi. So I guess that leads on naturally to the next question about what can we do in terms of protecting immunization services throughout the epidemic? What we know is best practice to ensure continuity and to support these programs at this time. Dr. Sheth, can I put that to you?
Right, of course. I just want to reemphasize what Dr. Wanodi said. That lesson is so important for us to learn from and act upon now. So very early on, the World Health Organization brought out these guidelines in March, and the CDC also provided guidelines for healthcare workers and for the public about how to safely vaccinate children. For example, in order to reduce crowding in waiting rooms, families may be requested to wait in cars until it is time to go straight into their exam room. So that's one way of reducing the contact that one would normally have in a waiting room. And in some other countries, they're trying out vaccinating in buses or in supermarkets to avoid healthcare contact. And other ways are to segregate well children by time so that the well children who need vaccinations are seen in the morning and then the sick children in the afternoon, and also in separately designated areas, so there's never any mixing. And in some warmer countries, vaccination clinics are being held outdoors or in openly ventilated areas where there is more space for people to wait. So these are some of the guidelines. I mean, they have to be practical and they have to be doable within the context of the place that they need to be implemented. The very important point that all of these guidelines make is that safety is highly emphasized. The healthcare workers have to be safe, and so do the parents and children.
Thank you, Dr. Sheth. Dr. Wanodi, do you have anything to add from your perspective, particularly sort of taking into account the kind of practices that are being pursued in Nigeria at this point?
Yes. I think it's really important for the programs to decide what works best in their context. One of the things that programs need to do is to be able to take risks. So, for example, in Nigeria, to ensure that outreaches happen, we'll need to make sure that health workers have masks and then their clients have masks. So each program needs to decide what works best in their context. And I want to emphasize the importance of not letting the immunization program decline so much that people lose trust in immunization services, because ultimately the best solution for the COVID pandemic really would be a vaccine. And we want to maintain this trust in the vaccine system so that when a vaccine is eventually rolled out, people will access it and uptake it. Maintaining the trust in the immunization program is really key. Another thing is making sure that parents recognize that all efforts are being made right now to ensure safe delivery of immunization services. So they should not be reluctant to take their children for vaccination. They should avail themselves of those services. And then finally, we know that in fighting the COVID pandemic, governments are spending a lot of money, and some of those monies they're spending are being diverted from immunization programs. So it's really important not to divert immunization funding and keep the programs running to avoid the excess deaths, to avoid losing trust in the system, and then to maintain the systems when eventually a COVID vaccine comes on board.
Thank you, Dr. Sheth and Dr. Wanodi, so much. I think it's been really interesting to hear your thoughts about the potentially significant impact that COVID-19 will have upon immunization programs across the world, but also the good advice that you have about how one might be able to maintain immunization programs at this time, and the importance of doing so, given the how critical it is to maintain trust in immunization systems going forward. Thank you both very much indeed.
Thank you for having us.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.